Hello, good afternoon. Good afternoon to everyone. Myself, Dr. Kunal Kumar Jaiswal. I am a pediatrician and a consultant allergist. I have pursued my MBBS degree from Kolkata and PG from Mumbai. I have done a specialization course in allergy and asthma from BV Pune. I have been in this field for last 8 years, practicing as a pediatrician and a consultant allergist. I would like first to thank this Baby Chakra app for giving this opportunity to me for this live session and to communicate with the parents live. I am here today to talk on the topics and the mouth disease. As predicts, it's a disease which mainly affects the hand, foot, and the mouth. It's a very common viral illness which mainly affects a child less than under 5 years of age. Mainly the preschool children are more commonly affected. And this is the season when the cases are high, the outbreaks are more common. This is a viral illness, unlike any majority benign and self-limiting. It resolves over 5 to 7 days. It is mainly caused by a virus, which is mainly called the two group of family, Coxsackie virus and enteroviruses. These viruses mainly affect this less than 5 years of age children, the preschool children, nursery going school children. In this disease, like many of the viral illness, mainly start with the low grade fever or no fever. Child may complain with a sore throat, mild body in weakness, and which is followed by the appearance of the rashes, which is predominantly on the hand, foot, and the mouth. The rashes are mainly, if you define the rashes, it is a maculopapular rashes, what we commonly use in the medical term. It means start with a slight redness and then pinhead type of elevations, which may be followed by a vesicular rashes like a fluid-filled vesicle. The typical of this is the positions or the site of the body which are affected. In the hand, it may affect the palm, foot mainly the soles, the knee area, hand also behind the elbow area, and the buttocks. Also, it is affected with the reddening and followed by a vesicular rashes and the ulcer. So as it affects the hand, foot, and the mouth, so it is commonly called the hand, foot, and the mouth diseases. These are the viruses, like the carrier for these diseases is usually the human. What I mean is this virus is mainly transmitted from the one to another. The source is the human itself. It is not transmitted from any animal. I mean, so we can contact how our children are contacting this disease. Source of infections are mainly the fecal-oral route and respiratory route. What I from the fecal-oral route, it means these viruses are inside the human beings. So through any routes, the human being has ingested these viruses. Any route like through the contaminated water, through the contaminated foods, or by touching, they have ingested this. These viruses have gone inside our GI tract. It has multiplied in that individual, and it produces the symptoms, what we have talked about, the fever and the rashes. Audible? Yeah. This is the one, the fecal-oral route, what you say, and the respiratory. Respiratory route is mainly through the droplets, through the sneezing, coughing, and when the infected person Okay, sorry for the delay and technical issues. Am I visible now? Okay, go back a slide. So as I was speaking, the how this child can contract this disease. The mainly we have the two routes, which is called the fecal-oral routes and the respiratory routes. Through the fecal-oral routes, I mean through the contaminated, the infected person has ingested these viruses. His viruses has multiplied inside his gut, and that is split out in the fecal matter. And through this fecal matter, which may contaminate it or through the food items, these are re-ingested by the humans and the child, and this is reinfect the another individual. So here the purpose is that the hand hygiene, the hygienic practice plays a very pivotal role in preventing this disease from one individual to another individual, and that is one important thing. Second, as I told, the respiratory pathway. The respiratory pathway mainly the droplets. What are droplets? These are the particles which mainly contains this virus spread when the person speaks, sneeze, or the spreads to a distance. We say 3 to 6 of distance it can travel. So through these respiratory droplets, this can through the fomites. What I mean fomites, some articles are there on the table. The infected individual is coughing, sneezing, or speaking. It has gone passed off onto that surface. And when the individual touches this surface and touches over his face or mouth, this surface has infected him. So these are the common infections from which an individual acquires these viruses and result into disease called hand, foot, mouth disease. This is the pathophysiology, how it affects. Now, how to deal with this. So really comes out 5 to 7 days. Majority of the patients, of 90-95 patients, this is a benign condition. It do not result in any sort of a complications like any other viral illness. You have to take a symptom. What I mean from symptom management, treatment, fever, we give a fever medicine, having a pain, fever, topic. So symptomatic management mainly gives no role of any end in this. And the most important thing is when it affects the oral cavity, oral ulcer, which is a painful, the oral ingestion is compromised. And the child, as we know, they are more prone to any dehydration. So oral intake has to be maintained. That is very, very important. That oral ingestion should be there. That child is not dehydrated due to hand, foot, mouth disease. So this is the treatment wise. This is the symptom with oral hydration, oral analgesic, everything. The complications we can take care of. Common complication as we go on, we'll take on the questions and answer one of the questions. If there are questions regarding to this, we'll based on that also. The prevention, just a second, we'll complete off with prevention. So prevention, as I told, the two routes, that is hand practice and avoiding of the crowded places, the poor ventilated areas. This can help us to prevent our child from acquiring this disease. So now let's take some questions. There are the question chat. I'll go by one. What are the factors that increases the risk of foot and mouth diseases in the kids? So as this diseases is mainly treated by the fecal-oral route and the respiratory pathway. So the factor which can affect or increase the risk of the hand, foot, mouth disease in our kids is the hygiene. That is very, very important. As we have all passed of time, we all know the importance of the hygiene and sterilization. And it is equally pivotal, like that virus, the virus infection. So the hygiene plays a very important role. Poor hygiene, street foods, the food which street food we are eating, if the hygienic is not maintained, then we can acquire these viruses. Secondly, the respiratory rate. So going to a crowded place, not taking great precautions, not in the distance, social distancing, or go to the crowded places. Our kids are going to the area, play area, or any area which is very poorly ventilated and excessively crowded. In reason, the child can acquire the infectious droplets. And through the poor hand hygiene, they can acquire the oral routes. So these are the risk factors for acquiring the infections. Second question which I have, how can I prevent hand and foot mouth disease in my 8-year-old child? As I told the factors, as I told about the risk factors, so if you take care of the risk factor, you can prevent the hand and foot mouth disease in your old child also. So what prevention means? I will repeat the same thing, the hygiene. Again, the hand hygiene is pivotal role preventing any infectious disease. Like any other disease, this is also a condition. I mean, it's spread from a human to a human. So proper hand hygiene is a strong barrier to prevent your kids from from acquiring these infections, and the respiratory precautions like avoiding crowded places, wearing the mask, avoiding the close contact with the individual who is suffering for the hand, foot, mouth disease. Third question I have: my child is suffering for foot and mouth disease. What is home care we can I take care? Home care, first, most thing, infectious, contagious. First, your priority should be the one infected individual member. Do not transmit diseases to other individuals. So what you have to take care? For first 5 to 7 days of this onset of illness, that this is infectious to others. So first 5 to 7 days, you have to take a proper precaution that his used anything, articles or the utensils or the garments, anything should not be shared with another child. Because as told, the fomites also act as a source. What I mean fomites, infection, viruses are shared off on some object that is being touched by the healthy person, and that person acquires the infection. So there has to be isolation sort of thing, but the common thing should not be shared. And this is also prevention. And secondly, for the child who is infected, you should give him with a good hydration, give him the soft diet, and continue the symptomatic management as advised by your doctors. One more I have: how can a hand foot disease be treated in a kid? Is it a serious disease? As I told you, this is a viral illness, and majority of the case, this is a benign and not so serious. Till now, my 8 years of experience, whatever case I have seen in the hand foot body is very Mumbai region. I have been in the Mumbai for last 4 years. So this is a season where we see majority of the patients for the hand foot mouth disease. Until now, I have not seen any patient need to be hospitalized. All the patients have been treated in the OPD basis. As I told, is majority of the cases, this is a benign, self-limiting matters. Just a symptomatic management, home care, proper hydration, and the soft diets will take care of this. It can be a serious disease. There are complications which there are viruses, like enteroviruses. Some of the variants of the enteroviruses are there, and the coccidiosis, which may have a serious complication. The serious complication is from the brain. It can result in encephalitis. In the heart, it can be myocarditis. It's very, very rare. The possible complications are there. What I mean for encephalitis is the child is getting irritable, is getting lethargy, means is drowsy, lethargy, not active, its activity is very poor. He may have a seizures. Myocarditis, what I mean, child may present with the sudden respiratory breathing difficulty, chest pain. So these are the symptoms of myocarditis. So these are the common abdominal pain. These are the common. These are the rare but the serious complications. So are there any danger signs of this disease that needs emergency attention? So as I told, the child has acquired 5 to 7 days. You have to be vigilant. This is infectious to others. At the same time, you have to keep watch on your child. Is not presenting very the danger symptoms. As I told, is not getting lethargic. Is very, very poor due to the oral lesion. Very, very poor oral intake. Dehydration. Dehydration means child is again lethargic, poor urine output. Myocarditis, if he complains of the breathing difficulty, he complains of the chest pain. So these are the serious complications where you have to be the nearest hospital for the emergency. So these are the emergency signs, symptoms. You have to be attentive. Okay, I think just a takeaway message I would. This is the common virus. It's common this rainy season prior to summer season. Not to worry, it will heal off 5 to 7 days. Is majority of the cases. Just a symptomatic management will take care. And most important is this: it is infectious to others. So once one of the child is infected, you have to make sure that you take all the proper precautions that is not infected with other family members. Your child infected with the hand foot mouth disease, ask your TT pediatrician to give a written that you should have kids because he can be a source of infection. So these are the precautions you have to take care. And as I repeat, prevention is very, very important. If you take care of two things, hand hygiene and the proper social distance, avoiding the crowded places, you can prevent your kids from acquiring this disease. Thank you. Any questions? Okay, I would like to thank this Baby Chakra app again for giving this platform for and communicating with the parents. Thank you.